Okay, go ahead.
Good evening.
Mm.
Good evening. I'm Commissioner Tracey Parker Warren of the Maryland Workers' Compensation Commission. I'm also chair of the Labor and Industry Committee, and we're here this evening to discuss issues concerning workers' compensation. We're going to discuss some about the legal process, and we're also going to give you some information concerning what medical knowledge one might need to know. I would be remiss if I did not take this opportunity to thank all of our veterans out there, as it is very much close to Veterans Day. And Dr. Frazier here, who is seated to my left, is a veteran. I want to especially thank you for your service. And I also want to thank you just for being here this evening. I know you're super busy, so I appreciate your time. And we also have attorney Mayah Wells here. She is an accomplished attorney and knows a lot about the legal process. And I thank you as well for your time. Thank you for being here. So I want to start off by just getting a 40,000-foot perspective of what a claim looks like. And then from there, we're going to talk about some medical issues that might arise and why even a Dr. Frazier could be relevant to your claim. So I'm going to hand it over, and we're just going to have a frank discussion, and you will also be available to take questions if you might have some toward the end. Attorney Wells.
Well, thank you so much. I appreciate you for having us here. I do appreciate everyone for, can you hear me?
Turn it up.
Everyone for inviting me tonight. So I am an attorney who represents claimants in Maryland for workers' compensation injuries. And generally what that means is that in the event that you are injured in the course of your employment, any kind of injury that you have, workers' comp coverage. So the purpose of the workers' comp is to make sure that people, whether it's your fault or whether it's someone else's fault, are covered for injuries that then sustain while they're working. So usually the way that we first start off a claim is by filing a claim form with Maryland Workers' Compensation Commission. So anytime that you have an injury, obviously, after you want to inform your employer, you want to let them know and you want to inform them exactly what happened. After that, you want to file a claim based upon the injury that you had. Very specific, you want to include how the injury occurred, and you want to include all of the body parts that were injured. It is very, very, very important how you file the claim, because that typically can dictate how your case is going to go forward from there. So say, for example, you're very vague in the way that you file a claim. Well, the insurance company, who's on the other side of everything, they're going to say, oh, well, we don't really know how you were injured. Maybe there's some inconsistencies, which is going to cause for you to have a hearing when otherwise you might not need to have one. So specificity is really always. But before we sort of get to the claim piece, we want to talk about injuries in general. So what kind of injury is an injury that can injure up in workers' compensation? Slip and falls, injuries to your head, literally anything that you have that occurs while you're working is generally considered a compensable injury or something that occurs in the course of your employment. And so from there, there's also occupational diseases. Now, occupational diseases are different. It's usually if you, say, for example, you're working as a firefighter or you're a police officer or something of that nature, and you end up having hypertension sometime down the line, or maybe you develop blood cancer or something like that. And you know, or you believe that it is because of your time in the service or your time of working. Those are occupational diseases, and generally an attorney will be able to help you understand whether or not you can make that something. So aside from just having the injury, you must be an employee. Not everybody is an employee that works. You could be an independent contractor. You can just be working casually. So it truly just depends if you're an employee, and if you are an employee and working, then you are entitled to receive workers' compensation benefits normally. Now, there are many different circumstances that exist for why a case would not be something you'd be paid for. And an attorney would certainly be able to help you figure that out, depending upon your circumstances.
I would also add, I agree with everything said. I would also add that in so many circumstances, the employer or the insured disagrees with the claimant's attorney, and you could find yourself receiving a hearing notice to come explain your position or coming to explain the circumstances under which you were injured?
And often than not, I would say, well, just on that point, unfortunately, these insurance companies, they very, very much will find any reason to sort of nitpick at what happened, your claim, the injury, the extent of the injury, and you will oftentimes end up in front of someone like our honor here, who will have to determine whether or not you have a case. And oftentimes, it depends on your medical record, it depends on how you reported the injury, whether you reported the injury, whether you obtained medical treatment in a timely fashion, what kind of treatment are you treating for? Also, how extensive is the injury? Did you have pre-existing issues that otherwise made your circumstances much more challenging? All of these different circumstances can cause a need for you to need in front of a commissioner.
I have a question for you, Dr. Frazier. Under what circumstances, or how do you determine, or how do you refute an employer who might say, oh, you may have gotten credit work, but your current symptoms and complaints are really due to a pre-existing condition? Is that something that you see? Is that a question that you're asked to address?
Yes, nearly every day. That question comes up in my clinic. Is this injury due to the fall in question, or is it something that was already there before the fall? Was it already, symptomatic? And so in my experience with this, I have to take my patients at face value. If my patients say that they never had any issues with their shoulder before they fell at work on that day, and then they fall and now they need medical attention for it, then in my eyes, it is the fall had something to do with the need for medical attention. Then there comes the medicine in it. And I was going to have a lot of that in my talk, if this would be a good time to do it. But, and so I did, make a little presentation for this type of thing.
More information about your background. I apologize for not giving all. You have a wonderful, impressive background.
Yeah, sure. I am an orthopedic surgeon at Premier Orthopedics. Is at the top. Partner owner there, Premier Orthopedics. For Premier Orthopedics, I was in the Navy and joined. I was an orthopedic surgeon in the Navy for 9 years, and then I got out and I started private practice here. And so I've been doing this type of medicine, workers' comp medicine, and seeing legal type patients for the last 8 years, and so very well versed on this and deal with attorneys like Ms. Wells a lot and their clients. See, but for this, a lot of the things that Ms. Wells and Commissioner Parker just talked about are in this talk here. Now can address these workers' comp issues from the standpoint of a rotator cuff tear, which is a shoulder injury. So go ahead, next slide. And so looking at like rotator cuff injuries, this is something that I see in every type of worker. It could be a teacher, it could be computer scientists, definitely police officers, firefighters, everything. Anybody who ever lifts something above their head or has a fall or anything like that can get a rotator cuff tear. But and so what we just talked about is the second line. It could be pre-existing degeneration, and the employer that they were just talking about is going to, if they find any signs of pre-existing degeneration. So anybody over the age of 40 can have pre-existing degeneration of their rotator cuff. And that doesn't mean you're hurting. My shoulder doesn't hurt right now. I could have it. But if they find that sign, then they're going to try to say that your injury is due to the pre-existing findings. Very common. So reporting it and being consistent on how you report your injury is super important, as Attorney Wells just said. And then, so what we want to do is provide high quality care and get you diagnosed and treated appropriately very quickly. Go to the next slide. So I put it in bold right here. You always want to document the mechanism of injury. So when you go to that doctor, you always want to tell them how you got injured, what was the circumstances around it, and make sure that that gets into your chart. And it is consistent with every person that you see that is going to treat you. That is your doctor, that is your physical therapist, that is the emergency room doctor. You can tell the people at the MRI place, they probably won't put it down, but you can tell them too. All right. Then any prior history of complaints at the same joint. So if it's your shoulder, you want to be forthcoming about any prior treatment that you had, because if that comes out later, that can be a big problem for you and everybody involved. And so we try to understand your work environment so we can treat you appropriately and get you back. Next slide. And so along the pre-existing findings that we were talking about, we'll go on this side. We like to get x-rays of your shoulder. And so a lot of times I'll have somebody with a rotator cuff injury and they tell me I never had any problems with my shoulder beforehand. And then I get an x-ray that looks like this one up here. And, you know, to everybody else, this is the shoulder. But, you know, there's a lot of different findings on here that took a long time to get this way. This is not a normal shoulder. And so even if you've never had any problems, we'll take this x-ray and it'll say, oh, you've had a rotator cuff tear for years, right? And then you fell, but you didn't know it, but you fell and it made it worse. And now you need treatment. I think this is still compensable. This is still, you know, can be treated under workers' comp, but we have to acknowledge the part that was pre-existing and then the part that was injured at work. All right, and so these x-ray findings and MRI findings can, you know, tell us and point us in these directions. Next slide. So these are the other factors that they look for in order to, you know, say that maybe the work injury did not cause or the symptoms. So, you know, things like somebody who is depressed, they are a heavy smoker, they have diabetes, you know, litigation stress. So the stress of, you know, going through a legal case, all of these things are extra things that can both, you know, bring your case into question, but it also affects your care overall. So, you know, if you have diabetes, you want to make sure it's controlled. If you have an injury and you're a smoker, you want to, you know, try to cut down on the smoking. If you have depression type symptoms, definitely want to be able to see somebody about that to, you know, help with your care overall. Next slide. And so, you know, this is more for treating people, but, you know, the delay in the case can cause, you know, the case. So if your case is kind of blurry or, you know, not quite, and you have to go to court like Attorney Wells just said, then it can take a long time for that process to happen, and you will be sitting there waiting to get your treatment. And so that, you know, results in chronic pain issues and things like that. So you want to be very clear about this up front. Next slide. And this is, you know, more for treatment purposes. This is how we, you know, intend to treat you. Next slide. And so, yeah, so I would say this one is for that as well. We can, you know, come back to these things if needed, but I think, you know, that addressing the pre-existing problems associated with this, yeah, that kind of addressed that there.
So we talked a little bit about when a claim might or might not be compensable. So what happens in your when you have a claim, it survived Dr. Frazier, and you have a, you know, a good medical report? What happens when there is some pre-existing, but your claimant wants treatment? How do you engaged in conversation concerning what the employer insurer might provide for treatment and what is not provided, although the claim is otherwise compensable?
So usually, if you have a pre-existing issue that you're dealing with and you're managing, right, you have to take someone as they are. And so that's what the law provides for, that we are able to take people in the manner, in the way in which they are. So if an example with Dr. Frazier, he mentions the pre-existing issues with the shoulder. Let's say you have an issue and it's ongoing, but you're working, you're able to lift 50 pounds, you can lift overhead, you can maintain yourself. And then you have an injury and it's traumatic and you fall on the shoulder. Now you have a rotator cuff tear that is going to require some surgery. Usually the insurance companies, as Dr. Frazier mentioned, will fight this tooth and nail. They will say, oh, well, they had pre-existing problems and all of their current symptoms are related. But Dr. Frazier says you can't work. You're unable to engage in your normal course of employment and you need surgery. Usually you have an attorney who will come and they will need all of your pre-existing medical records. Usually what I would do is I would ask you, whoever you treated with, get your primary care records, get any prior surgeries that you may have had on the same shoulder, get every single thing, and I will provide that to the doctor to evaluate to see whether or not he can causally relate the current need for treatment to this claim and ultimately get that care. Now, if the commission approves it, that's a big if, because it's also going to depend upon whether or not you are a credible individual, whether you're presenting in a manner in which is truthful. And so that can be difficult no matter what, because if you have that x-ray that was shown and you say you never had any problems, but then they have an IME doctor who says there's no way that they didn't have any issues, doesn't make any sense. And then you go and you tell the commission that you never had any problems, but you have all this stuff. The best thing to do is just to be honest and to be forthright with what you're dealing with, and then to move on from there. So normally the commission will, depending upon how you testify and depending upon if you have causal connection letter, meaning a doctor who says, hey, this is related, it's necessary, and you testify, they will usually allow you to have that treatment and to get you back whole. Now, the question that becomes later down the line, if you continue to have symptoms, are those symptoms at that point still due to the traumatic injury, or are we now in the realm of the pre-existing issue? And I think that that would be more of something that a doctor would be able to say rather than myself, but I would generally have that person evaluated and the doctor would be able to tell me, okay, they have this much impairment that we believe is causally related to the injury and this much that is related to pre-existing. And so from there, we would just sort of continue with the case.
Yeah, I mean, I think that is, from a doctor standpoint, is you're trying to answer the question, okay, if somebody had changes in their body before this injury, but didn't know they had changes in their body before this injury. The question is, would those changes lead to the patient's current state now after the injury, right? And so, or would the patient have gone on about their life still not knowing that they had those changes? And that's the question that, the doctor has to answer. And in most cases, there's no exact answer to that. There is, educated opinions on it. And so, but we give those opinions based on, our knowledge and training. And then we, give those opinions back to the court. And then attorneys and judges have to decide based on those opinions.
Can one or both of you give examples of what type of treatment could potentially be available to a claimant depending upon how they present? I know we talked a little bit about surgery, and I see your slide here mentions physical therapy. Could you give an idea of what might be available to someone who suffered an injury at work?
Yeah, and so that certainly depends on the injury, but in most cases, when we treat people, we want to start conservatively, and that would mean start with, the least effect or the treatment that will have the least effect on the body, moving up to the treatment that has the highest risk. So we generally want to start with something called activity modification. So if you're at work and work is causing your problem, then we try to remove the work environment or that part, and that's called activity modification, taking you out of work. And we see if that, helps. And a lot of times, in a lot of cases, that will help. And that way, you don't have to put medicine in a person's body. You don't have to, stick them with needles, or for me to do a surgery, which is a much higher risk affair. But if the activity modification doesn't work, then, we give medications. We do physical therapy to try to strengthen and re-strengthen the body. If physical therapy doesn't work, usually in my field, we have different types of injections that we can do in order to target certain areas of the body. And if all of those things don't work, and they have the certain pathology that needs to be fixed, then I would schedule them for surgery and then fix the area that needs to be fixed. After that, they would have to do their physical therapy, get stronger in an effort to get back to work.
I think Dr. Frazier basically covered everything. I mean, just from the attorney standpoint, I have seen individuals who do, as you mentioned, treat conservatively, which includes mostly just physical therapy, sort of less invasive things. And then sometimes it can even graduate to injections, right? If, say, for example, the individual has, let's just say, an injury to their low back. And I've seen epidural injections to try to help alleviate those symptoms, or sometimes it's used for diagnostic purposes, perhaps to try to identify sort of what the issues are that they're dealing with. And then it can elevate to surgery depending upon if those modalities fail. So, it really just depends on the extent of the injury. And sometimes people recover. I mean, it has happened where people make full recoveries through treatment. And I've had some of my clients come back and they say, hey, I'm all done. I'm feeling great. I said, great. And then say, is there anything else? I said, no, that's all, that's it. So in the event that there's a full recovery, then there's generally nothing else that us attorneys would do. But sometimes, as I mentioned a little earlier, you don't always get back to 100% of who you were before this injury. And then you're left with sort of residual issues that are impacting your day to day. So normally in those circumstances, after you're done with your treatment, you have what's called permanency. And permanency allows for you to be able to be compensated in Maryland for any residual issues that you're facing. So if, for example, back to the shoulder, you used to be able to, you're an avid swimmer, and maybe the butterfly was one of your favorite, forms of swimming. And now you're no longer able to do that at all. You can't even get in the pool, much less sort of swim like you used to. You would be evaluated for permanency by Dr. Frazier, who would say, this is how much impairment you have. And then the commission would determine how much, if any, you are to be awarded for an injury like that. So rotator cuff injuries I've seen, range from 15% or so impairment to more significantly higher. And there's a really weird formula and calculation. I'm not going to go into it because it's very convoluted to interpret. But basically, it boils down to you're entitled to a certain amount of weeks, and those weeks equate to the amount of money that you will get for your injury. So usually once your case is over, that's generally sort of the next step that we take is to move you forward with permanency. And that's really just if we're not talking, and that's if you go back to work. Like there are circumstances where some people can't go back to work. There are circumstances in which people can go back, but they have restrictions, so they can't return to their old employer anymore. And that might entitle you to receive vocational rehabilitation benefits, which are basically benefits. It's not therapy. It's an individual whose job it is to help you find employment based upon your restrictions. And so sometimes we have to go down that route to help you.
Thank you. So I've been asked by a person in the audience to pose a few questions here. And I suppose too, maybe we're being somewhat technical because we do this every day, but the question posed is, what should a claimant know about appearing before a workers' compensation commissioner and how can they prepare? I feel like I will defer to Attorney Wells.
Well, thank you for the question. I think there's a lot to know. But the first thing is to be presentable. I think that you always want to show up like you're ready to, do business. This is a judge, this is a formal setting. So you do want to present yourself in a very respectable manner. Your attorney will prepare you, and that is something that you will need. Now, sometimes people appear pro se, which basically means that they go and they represent themselves. Depending upon how complex your case is, you might not want to go by yourself. You might not want to do it alone. And so there are many instances in which you should need an attorney. And sometimes people are competent and well enough that they can do it themselves. But these insurance companies, they keep attorneys on retainer. They're attorneys who represent insurance companies exclusively. So they're not in your best interest, right? They're not fighting for you. They're not there to tell you what the law is. So if they give you, they won't give you advice because they can't. But if they tell you something, just know that there's another side to that story. And so the other side to the story is generally when you go and get an attorney like myself, who would be able to advise you of what you're entitled to receive. So when you go before the commission, aside from just being sort of presentable, you want to know why you're there. What is your goal? What is the purpose? Why are we in front of the commission? Are we there because we need more treatment? Are we there because the insurance company said that I was not heard while I was working and they're denying my claim in general? You need to know the purpose that you're there. And then sort of once you know that, then you're going to be able to sort of let the commission know all the information that they need to know, so that they can decide on whether or not they're going to approve your claim. I would just say that it varies, but one thing I can just tell you on how to testify, just generally, you want to just listen to the questions being asked. I want to start offering more information than what anyone is asking you. Because usually people can get off on a tangent and start saying things that are not related to the case at all. Be respectful and allow the questions to come out. Let people ask you the questions that they need. Don't interrupt, because we have court reporters. They take down information. It's important. You also need to know that after everything is said and done, a decision will be made. And once a decision is made, you usually have 30 days to file what's called an appeal. So let's say, for example, you don't like the outcome of the order. Maybe the commissioner you felt didn't quite see it your way, or they denied your benefits. So in Maryland, you can file an appeal to the circuit court in the county, usually in which your injury occurred or where you live. That's the best time or best choice to make, to have a jury of your peers perhaps to decide and help you decide the case for you. So a lot of different things can happen when you get to the commission level. And a lot of things you need to be prepared for, including having your medical records on point. Last thing you want to do is show up to the commission and you need medical treatment, but you don't have any medical records to show where and what we've done up to this point. That's essential. But it's also something that an attorney would be able to sort of help you navigate. It's not a simple thing to do, to go and do it for yourself, but I have seen it done. And usually when you get there, commissioner, like our commissioner here, will advise you to go and find an attorney, usually, because it's needed. So anything that you need in that respect, we can usually help.
And so in preparing for a trial, how or why would you engage a person like Dr. Frazier? Or Dr. Frazier, or I'm not sure who would like to take the question, but I know the answer to the question, but for the people that are listening, what sorts of documents or evidence do you generate? I suppose is what I'd like to know.
So for us and in our practice, understanding that someone that is under workers' comp, that there is a legal case attached to that. And so in our practice, we do put emphasis on establishing how the patient was injured or how you were injured, and making sure that that is well documented in our notes. So that there's not a question on, how you were injured. And a lot of my colleagues, well, we don't learn this in medical school, that part of it. In medical school, we learn how to diagnose and how to treat the patient, and then we move through. But so in medical school, it doesn't really matter as much how you were injured. But in the legal world, that is paramount importance. And so we make sure in our documentation, we do that. I think that's what attorneys can gain from doctors like me. And also we do medical legal reports, called independent medical evaluations. And those, we are able to put those ratings. So we examine a patient and we use a certain formula to give the patient a rating for their shoulder, which you need in order to, under an impairment rating, excuse me. And so, or their shoulder or their back or their elbow or wrist or whatever. And you need that impairment rating in order to be compensated for your injury.
I think on that, we would always engage a doctor for any issue that involves a medical issue, right? We're here for workers' comp for treatment. So we would engage someone like Dr. Frazier and his company for treatment from the beginning. And typically for causal connection letters. So say, for example, an individual had a prior injury to their knee and they were working, they were fine, and now they have new issues that they need to get treatment for. We would have to reach out to Dr. Frazier's office, who's treating the individual, to be able to say, hey, doctor, do you think that this treatment, do you think that everything that this person is having is doing is necessary and is causally related to the work injury? So of course, the mechanism of the injury is essential because how you got hurt is important, not just for the purposes of the legal documents, but also for the commission. Was it a twisting injury? Did you fall directly on your knee? Did you fall 2 stories and land on your feet?
Did the forklift run over your foot?
How did it happen?
Yeah.
All of these things sort of matter with the commission and for their sake to be able to try to say and determine what kind of treatment could be. So we would always sort of engage the doctors to try to see what they believe is related to this case and what they think isn't related, because that's really how we're going to, as attorneys, help the claimant move along in terms of receiving the care that they need to get back to work.
Yeah, and what she said too, and determine what isn't related to that. Because people a lot of times people in the workers' comp, you get in a workers' comp thing and everything, starts coming in. And so if I'm treating you for your neck and your back and your shoulder that was injured when you fell off that forklift, 6 months later, I don't need to hear about your toe. Or 6 months later, I don't need to hear about your other, hip that started hurting you 2 months ago. And so it's up to us as medical professionals to say, no, that's probably not related to this fall. This could be related to something else.
But you do need to hear about diabetes and stress, but you don't need to hear about this other stuff.
Well, yeah, I mean, those other things are,
obesity.
That helps with me certainly with my treatment decisions.
Yeah.
So I do need to know your past medical history. But, saying that other body parts were injured on the same day that the original body parts were injured, but you're just bringing it up, 4 months later, that doesn't work out in workers' comp. typically.
So, on that, I want to ask you about what, like compensating injuries, because I've seen where an individual, say for example, they have that left shoulder issue and now their whole left side is incapacitated and they can't use that arm at all. And then now they got to rely on their other arm and for lifting all the groceries and picking up their kids. And now we're doing it more and more. We're using that a little bit more. Have you seen in instances where in those circumstances, you can relate that other arm?
Yes, and that's something that we regularly see is overcompensation type injuries, and we talk about those. I talk about that a lot with my patients, but from a medical standpoint on it, I always try to fix the originally injured area first, and then we see what's going on with the other side that just kind of started hurting when you were using it more. And sometimes, yes, after that, after the original side is addressed, then the other side is continuing to bother them. And, we address it. A lot of times when the original side is addressed and it stops hurting, the other side stops hurting as well, because you go back to normal mechanics. We take that case by case, but there are things such as overcompensation injuries because you're using one side more.
Nice. I was just wondering, what is there a particular employment status? So do you have to be an employee? Do you have to be an independent contractor? Do you have to be, what type of status as an employee am I eligible for this type of workers' compensation?
So thank you for the question. I think in Maryland, you have to be an employee. And so you must be an employee. You can be part-time, you can be full-time, but you have to be an employee. And the way that we distinguish sort of employee from independent contractor, which is oftentimes what people, have as a status, is control. So in Maryland, usually if there's a law behind this, the long and short of it is who controls the individual. Do you have your own uniform? Do you have your own company and you contract with another company and you're paid separately through your company and it's completely different? These things matter. So it's always circumstantial, sort of how we determine what and who an employee is and whether or not you're entitled to receive benefits from that particular employer. Were you working for, let's say, construction? That's always a huge thing where an individual's working for construction company B, but like the big company is construction company A, but let's just say B doesn't have insurance. I mean, I've seen it in cases where, now the general ends up having to have coverage for the individual that's down the line somewhere. It can get a lot more complicated than that, but usually you need to be an employee. Like say, for example, you're working and you work full time, you get a salary, you get wages. That's usually how we determine whether you're an employee. You get a W-2. We can determine that based on that. You wear their uniform. They tell you when to come to the work. Do you have a schedule from 9 to 5? Do you get to choose your own schedule? All of these things sort of factor into how you determine if someone is an employee or not. Versus an independent contractor. But independent contractors generally in Maryland are not employees, therefore they are not entitled to workers' comp coverage, no matter what. So I've heard people come to me many times and they're saying, well, I'm an independent contractor. Well, are you? Tell me about how you were hired. Tell me about who hired you. What was your job title? Did they decide on what your wages were going to be? Did you decide that you're going to work from 9 to 5? Were you wearing the uniform? Did you have to supply your own clothing? All of these things matter to determine that. And, sometimes you may think on paper that you're an independent contractor, but in reality you're an employee.
Or your employer may call you an independent contractor.
And you might actually be an employee.
Yeah.
Many times. And in fact, I had a recent case where, you know, an individual was called an independent contractor, but they very much acted in a way in which they're an employee. And it all really boiled down to uniform, you know, whether or not they had to go to monthly meetings they were required to attend. Yes, they could choose their own schedule, sure. But a lot of it was, okay, well, you had to use our forms and you had to use our information when you go out to places. You're a representative of us. Well, that doesn't make you independent. That very much makes you dependent and an employee. So under those circumstances, you know, you can be considered an employee and be entitled to compensation.
Is that something adjudicated through the process in front of the commissioner?
Very much so, and more often than I think anybody would like to. I know Commissioner Parker has probably seen thousands of those cases. And unfortunately, we do have to fight all of those cases. It's rarely, if ever, that an insurance company just offers to pay for someone's benefits when they look like they could be in a contract.
I have more questions. Go ahead.
I'm just gonna have to take a question. But one thing I want us to put into context is that although we have a claimant's attorney in an awesome position here, I want everyone listening to know, it's been implied, but I want you to know that 99.9% of the time, the employer and insurer also hires an attorney. And when Dr. Frazier gives an independent medical expert opinion saying that you are 35, 15, 20% impaired from the injury, you might likely have a physician from the employer and insurer side saying that you have 0% impairment. So as we are discussing, I just want everyone to keep that in the back of your minds, that there's always some sort of opposing advocate and or opposing opinion. So I just wanted to make sure that we're all aware of that as we're continuing to discuss.
I was going to say, unfortunately, they do hold the purse, these insurance companies. They do have the access that we need to the resources. So they will always have someone defending them, usually. Now, there are circumstances in which the employer is, let's say that they're uninsured, and they don't have insurance in Maryland. Now, insurance in Maryland is required for a company that has employees. And I believe there's a threshold number, but usually you have to always have insurance. Now, there are instances in which employers do not have insurance. And thankfully, we have a body that exists in Maryland that's called the Uninsured Employers Fund that provides benefits for individuals who are working for employers who are uninsured. And so it's rare, but it's probably more common than we like to say. Usually they don't have the coverage, especially in the instances where you're an independent contractor. They don't usually carry workers' comp insurance because they say that everyone's independent. But yes, there's always an opposite side, and they have the money, so they hire people to protect that. And so if they have someone, there's no reason why you should not have someone. And don't let anyone tell you otherwise. They will say, oh, you don't really need it, or there are many instances in which you do not need an attorney, but more often than not, especially when you have to go to a hearing, you should definitely have someone who's on your side helping.
Are there certain types of work that you see more frequently?
What do you mean?
Like home health nurses, or who have been injured by, dealing with a patient, or people who are cashiers or warehouse workers or transportation? Is there a particular?
I've seen the gamut. I mean, literally, I probably represent a lot of teachers.
Say more.
Probably a lot of teachers. I've had teachers who've been unfortunately beat up by students. Who are working with special needs, and they can't help it. They have to help the individuals, and sometimes they just can't control how that's happening. So teachers, police officers generally have a lot of claims because of the line of practice that they're in. And thankfully they're still able to go out and do what we need to help protect people, but they do have a lot. And I represent a lot of, those claimants. One field more than another, I can't say that there's one field that probably has more. I mean, Dr. Frazier probably has seen that. I'll have to defer to him.
And Dr. Frazier, when you answer the question, could you also give us not only industry, but also types of injuries that you see more frequent than others, if you have an opinion on it?
Yeah, for us, I mean, I treat tons of police officers, firefighters, correctional officers. I would say those are probably the majority of what the workers that come through our clinic. After that, then you're gonna have a mix of different types of construction and manual laborers. And then, you know, after that, probably are your teacher, home health nurses, people who have to lift other people. So with the teachers, it's usually more teachers who deal with special needs, kids and or younger children that they have to perform lifts or restraints. And it's usually those types of physical jobs that have these injuries. The overwhelming injury is going to be spinal injuries, injuries to the neck and back area. And then beyond that, it's usually injuries to the shoulder and knee. Those are the, you know, the most of the injuries that happen. And that's because of falls or some type of fall going to the ground. Because when you go to the ground, you put your hands out and that force will go through your shoulder. That force falls on your knees. And then your body gets jerked and that injures your neck and your back. So those are the most common things for us.
Could you also answer that same question as it pertains to occupational diseases like a carpal tunnel or something like that?
Yeah, so with occupational diseases, I see that a lot with teachers or people who do a lot of data entry, a lot of heavy gripping and repetitive heavy lifting. Get carpal tunnel disease. There are things like lateral epicondylitis or tennis elbow that people get a lot with occupational disease. Even some, you know, back issues with police officers or people who wear, or firefighters, people who wear heavy equipment for large amounts of time during the day. That has led to occupational disease for the back.
Have you seen, I'm sorry, have you seen some of these injuries that used to be greater, that have dissipated due to changes in how industries respond?
So for an example,
CTE?
maybe there is a firefighter that may be retired. Maybe they're 65, 70 years old, and they are filing a complaint for compensable occupational diseases like a lung cancer.
Mm.
But now that industry standards have changed and the equipment is different, just for an example, maybe there are less of them just based upon OSHA changes and such. I don't know the answer to that question.
I can't say I've personally seen a decline in any of the particular injuries that I treat for that. And I do also, you know, see a lot of NFL athletes, the Ravens and the Commanders. Even though when they get injured on the field, the workers' comp injuries, and so they go through the same exact process in that all of you go through.
Can you give us any names? No, I'm kidding. I'm kidding.
And so the jury's still out on whether or not all these changes in the rules with the NFL guys are going to lead to less concussions. But
Did anybody come last week? I got a bet coming up. No, just.
So, Dr. Frazier, in your opinion, is arthritis, or maybe it's a question for both of you, is something like arthritis compensable, or is it more degenerative?
All right, so arthritis, right? And this is, something that you have to deal with every day. Arthritis, The thing about arthritis is there's always a point where arthritis becomes symptomatic. And usually that point has to do with some sort of traumatic event. And so I played college football. I could have arthritis in my knees, which a lot of people have arthritis. I don't know because I've never taken an x-ray of my knees and my knees have never hurt. But if I took an x-ray tomorrow and I had changes in my bone because I fell leaving out of here and now my knee hurts and I take an x-ray and then there are some bone spurs and loss of cartilage in my knee, that should be compensable because I fell and that activated my arthritis that I've been living with for 20 years, right? But it was never symptomatic. And I probably, had I not had that fall, would have gone on and not been symptomatic. So I think that certainly the affecting event has to do with whether or not it should be compensable.
I would definitely agree with everything you said regarding that. And the knees are particularly known for having the arthritis in it and becoming symptomatic due to a traumatic event. I've definitely seen the instances where, say, for example, they have 20, 30 years worth of arthritis, asymptomatic, never had any issues because they're working, they're hard worker, and they never had any problems, never took Tylenol, no medications, nothing. And then they have a fall. And then sometimes I've seen it progress to now it's so bad that they even need to have a total knee replacement, depending on their age. And I've oftentimes seen, and had to reach out to doctors to see whether or not, do you believe that that surgery now is related, given that they've had such significant arthritis? And that symptomatic piece is essential. Again, going back to the mechanism of injury and how you were hurt. Was it just, it was a love tap across this table? Or, I've seen those. Or was it you actually fell on the knee and someone can understand how you would have the symptoms that you're having to the knee that require that treatment? So definitely, arthritis is huge.
I was wondering about COVID, whether or not COVID for nurses, because I imagine that, and doctors also was something, or people, any communicable, I guess, disease that they might be subjected to was also something.
Yes, so I've well, not so much now, but a lot back in 2020, 21, had a lot of individuals who come in with COVID-related issues and were unable to work because of upper respiratory issues. I've had clients who develop heart problems. I've had people who have died from COVID and represented those individuals, the state, for those related symptoms that ultimately were due to what they contracted at work. Nurses, I've only ever had nurses. I've never encountered or had a doctor who had COVID and were disabled by it, but even those cases can be compensable. And usually, again, you would have to have medical records to help support it, a doctor in that field who's otherwise treating it, usually an infectious disease doctor who can say this is related to, the circumstances at work. You didn't expose yourself anywhere else, right? That's a huge piece. Did you get exposed to COVID because you were, you went out a lot and maybe that's where you contracted it, not when you were a nurse working the COVID unit. You know what I mean? It depends on the circumstances. And so, a lot of the individuals that I've represented, nurses specifically, contracted it while working in COVID, on COVID units or directly with COVID patients. And it wasn't just they had it and they got better. Usually, especially for COVID, it debilitated them. It exacerbated a lot of their pre-existing issues. Maybe they had, I don't know, anything. Maybe they had pre-existing asthma and now things are much, much worse for them to be able to breathe. Or, it does affect like the whole body. So fibromyalgia, I've seen that people have that. And that just is far worse. And now they're just inflamed all the time that they just can't even do anything. Once you have that disability, and it prevents you from working and it's related, you have to have documentation. You got to be getting treatment. You got to be seeing physical therapists. And sometimes, you know, people will say, well, I've been treating, but nobody's paying for all this. I mean, unfortunately, you might have to utilize your own insurance. You might have to do what you can to help yourself first before somebody like myself can come in and get the necessary paperwork to make everything make sense. So COVID, I mean, it's tough to prove, but it's not impossible. And if it happens and you experience it and it's severe enough and there's evidence to help support it, usually in most cases it will be compensable.
Are there particular states like North Carolina, I guess, Georgia, Florida? We heard about how they were like open season during the COVID era. Did you hear from any like colleagues down there, or did you have any clients that may have been in there?
I didn't myself, no.
Mhm.
I mean, I've seen it, and here it was rampant here because, I had a client who was working out of state, who lived out of state, but they were travel nurses coming here to work.
Travel nurses, yeah.
And with all of the hospitals here to help us, and they live far and wide, and they didn't get it there, they just got it here. But I didn't have any of those experiences, but I know that it existed, everywhere, and it was definitely for a lot of people. And then there was like the long COVID that existed, that sort of happens after the main COVID, I guess, is no longer a thing, but then it continues to have long-term effects after a certain time frame to the point where it can become a permanent thing. Again, now I still have clients who are dealing with it and are dealing with permanent issues that are related to COVID.
Okay.
Dr. Frazier, we interrupted you really well. Would you like to go back to your presentation or your slides, or do you think we've covered some of it?
I think the more of that was just more getting into treatment, and that's just going to be for more geared towards treatment providers, physical therapists, nurses, things like that, when they should refer to us, things like that, not necessarily patient focused.
When a commissioner is looking at documentation and finding recommendations for treatment, do you think that the commissioner should hold an opinion from you, an awesome surgeon, in the same regard as a nurse practitioner? Does it matter where you're getting your independent medical evaluation? Neither one of these.
Well, I mean, I think I'm biased. But no, I think that, yes, you certainly consider the source. In medicine, if there is a musculoskeletal issue, so an issue with the bones, muscles, or joints, an orthopedic surgeon's opinion is going to be the highest level paramount opinion that you can get on that. There's no one else that studies the musculoskeletal system even closely to the amount of years that an orthopedic surgeon has studied it. And, there's no nursing school that can do that. There's no physical therapy school that can do that, or anything, of that nature, and see the amount of pathology and different pathologies that we see. And so I think that because of that, and that knowledge base, that an orthopedic surgeon's opinion for a musculoskeletal issue should hold paramount. Now, I mean, if a nurse practitioner is commenting on, their diabetic patient or their hypertension or what should be done about that, yeah, that probably trumps an orthopedic surgeon's opinion, because we just don't treat those types of things.
I think that, the kind of injury that you have and what you're treating for, that doctor is going to be essential. So as Dr. Frazier mentioned, orthopedic doctor would be perfect for the treatment for musculoskeletal issues. A neurologist might be more appropriate for head injuries, concussions, like you were mentioning, like if football players get, CTE or whatever, concussions, that's going to be needed to be treated by a neurologist, someone in that field who spends the time And ideally a board certified one, but it's hard to find the sort of board certified neurologist to treat comp cases usually because it can be challenging, but in that field is necessary. Like, for example, if you have to have spinal surgery, even maybe a neurosurgeon might be more fit for treating those issues, as well as the orthopedic surgeon. They both cover a lot of the same things. So it really just depends. Or if a psychologist, say, for example, not all injuries are physical ones. A lot of injuries are, some injuries can be psychological. Say, for example, you see something that's traumatic and you need to go and see a psychologist or a psychiatrist to try to recover and build yourself up from there. A psychologist is going to be the kind of doctor or therapist. Maybe they're not licensed in they're not a doctor, right? Maybe they don't have a PhD. Forget how you
PhD psychology.
Okay, but isn't there like a lower level, like a therapist, like master's degree? I think they can treat those as well, but they wouldn't be able to say, oh, you need medication or you need X, Y, and Z. That's when you would need to go to someone higher up, like a psychologist. So a lot of different people in that field can treat it, but trying to go to the right one, it really depends on the severity of your injuries and really what you're going through.
There are two types of nurse practitioners, right?
Oh, I'm not sure.
There's a,
One that prescribes medicine, another one don't, right?
well, once nurse practitioners become a nurse practitioner, then they gain the ability to prescribe medications.
Yeah, 'cause I had
Um,
that kind of.
Yeah, yeah. But there's a lot of different levels of nursing, yes, and before that, and a lot of different levels that can't. But once you get up to nurse practitioner level, then you can prescribe medications, usually under the guise of a physician. But there are, certain nurse practitioners that gain the ability to operate independently and prescribe.
And substitute certain medicines for others.
Well, sure, yeah, if they're
Yep.
prescribing,
That's,
they
that's,
can,
that's what I don't went through, yeah.
yeah, that would be part of it. Because you have to, if you're prescribing medications, you have to recognize side effects and interactions and be able to substitute appropriate medications because the same medication is not going to work for every condition in everybody.
Right. The worst medicine I ever had was Haldol.
It's pretty nasty.
Walk
Yeah,
around,
that's
moving
nasty.
arms.
Another question we had from a member of the audience, perhaps that's for you, Dr. Frazier. Do you discern, for comp purposes, do you discern a recognizable difference between arthritis as opposed to rheumatoid arthritis?
Yes. Yes. Yeah, there's several different types of arthritis out there. There is inflammatory arthritis, which is going to be your rheumatoid arthritis or psoriatic arthritis if someone has psoriasis, juvenile arthritis. But the most common type of arthritis is called osteoarthritis. And that is kind of the arthritis that develops in just over time in the body after micro trauma, but just develops over time and can be age related. But rheumatoid arthritis is kind of what you see in patients who it affects their fingers. You might see somebody kind of with their fingers, that look a little bit weird or maybe turned. We're actually not seeing that as much anymore because of a new type of drug called DMARDs. And they are, actually treating the rheumatoid arthritis and holding those symptoms off for longer. But it can get into, certain joints in the body, like the cervical spine, like the knees, the hands and wrists, and cause severe damage overall. But that is a systemic condition and not typically related to a particular injury event. Okay. Rheumatoid. So you have rheumatoid arthritis, you need to see a rheumatologist and get on the certain type of medications for that specific. That's different than somebody who got injured and a few years ago, and now one knee starts to hurt. And yeah, you look at it and you say you have arthritis, that's been developing over time. This is rheumatoid, and there's certain labs that you can draw to get that diagnosis of rheumatoid.
I know we had questions from the audience concerning insurance coverage and covered employees. I think we touched on it a little bit, but I wanted to make sure that the members here in attendance had an opportunity to pose any other questions or clarification.
Having worked on the employer side, there was, at least at the time, an exemption for companies that had less than 15 employees, which left their employees uncovered. There were exemptions that set in if you worked less than half-time. So a lot of employees were hired for 48% time. And there were companies that failed to pay their employment insurance. Unknown to anyone until somebody left a claim against it. Can you say anything about coverage during employer furloughs, even if all the other criteria are met? Because that happens as well.
One thing I would say is that to keep in mind that the injuries that we're discussing are injuries that occurred in the course of one's employment. So if one is furloughed and they're at home, it's difficult for me to perceive right now on the spot how an injury would happen if they're not in the course of employment. I'm sure there's probably something that exists, but I've never had that situation arise.
Yeah, I was gonna say, I haven't had it happen. I have seen injuries at home that individuals have had while working at home. But usually those are all covered employees. Say, for example, they just work a remote job. And, I've seen instances where they're going to the restroom, and they trip and fall, but they were on the clock, right? So whether or not that would be compensable, it really just depends on the circumstances. I think every circumstance matters. Really how they testify about what they were doing, whether they were on the clock, if they have a clock that manages their time, all of those things would matter. And you mentioned sort of part-time. Usually there is coverage for individuals who work part-time, so long as they are an employee of the company. So even if you work a location, let's just say 15 hours a week, some people have secondary jobs, like they work as servers or they work as bartenders, but then they have another job that they consider a full-time job. If you're hurt on that secondary job and you only work 15 hours, you're still hurt while in the course of your employment, you're entitled to benefits. I can't quite speak to the unemployment benefits piece because I'm not really familiar with it. Usually you have to pay, the insurance to have coverage for individuals who, are let go from the course of their employment. But as unemployment sort of relates to injuries, sometimes people do work and then they are fired, right? Let's say, for example, they are hurt on, day one, and then day two, they're just let go because they weren't needed. I've had to fight those cases where they've only worked one day. And, were they an employee? What were their wages supposed to be? That's a huge thing when it comes to whether or not you just work one day and then they fired. Or say, for example, people who worked at companies for 20, 30 years, and then they have an injury while working. And after that, then the company just fills their position because they can, right? So long as they don't fire them because they filed a workers' comp case, generally you're an at-will employee in Maryland, so they can just find someone else to fill that position. I've seen those instances, and people, if you're still entitled to benefits, you receive them. Even if you no longer work for the company, if you were injured while you're working for that company, it's still. So a lot of different circumstances around it, but there is still a threshold for employees. You mentioned, and whether or not you have to have coverage. I would have to do quick research, but I think it's like 10 or 15, I'm not quite sure when you have to have it, but I think it's imperative that you have it no matter how many employees you have. Because if you have anyone that you call an employee and then they get hurt and you're a small company, you don't have insurance, it could bankrupt. Potentially, I've seen companies that have had smaller employees and it's just like, it's tough. So you should have insurance because the individual can come after you. If you have the access to pay for it, the employer can be required to pay, or if they don't have the insurance, then you have to stuff.
I want to present what I'm going to pose as if it were a hypothetical question. I'm posing this as if it were a hypothetical question. Suppose a company had an employee injured on the job, and that employee was taken to the emergency room and seen immediately. And the company said, we prefer you just have all the bills sent straight to us. How would you advise that?
So I've seen those scenarios where the employer doesn't want you to go through workers' comp. They would rather just pay everything directly. That could be for a number of reasons, like they don't want the rates to go up, or they just want to deal with it. It is up to the discretion of the individual, and I think that it would depend on the extent of the injury, whether or not I would say that that's a good thing to do or not. Because in Maryland, we have what's called statute of limitations. And so the statute of limitations applies across the board. It's 2 years, barring some other circumstances, but generally it's just 2 years where you have to file a claim. So say, for example, the employer, they say, nope, don't, just send us all the bills. And you send them everything and then they pay, right? And let's say you're out and then they pay you some wages while you're out and you get care. And then let's say a year and a half goes by and you're still dealing with these issues. Maybe you had surgery and you're somewhat recovered, but you have lingering issues. They're not going to tell you you're entitled to permanency, right? They're not going to mention to you that you're entitled to receive benefits if you have these lingering issues. They're just going to say, hey, we paid your bills and you're back to work. I would advise those people to file a claim. And I hate to say it, I would probably advise them to file a claim no matter what. Whether someone tells you not to, I don't think they can tell you not to, but I'll probably advise that they file a claim just to protect themselves in the event that they do need, permanency. Or say, for example, the employer just decides that they don't want to pay anymore. And let's say you need more care. Well, the employer told you not to send anything through, just send everything to us, and then they just decide they don't want to do it anymore. Then what do? And then what happens after your 2 years has passed and they no longer do it? That's why I always err on the side of caution and to have that safety net. It's never a problem to have the safety net. They can't fire you for filing the claim. So, and if they do, there's retaliation, there's laws that can protect you and provide, benefits for you in the event that happens. But usually it's better just to file it as a safety net to make sure that you're covered no matter what, just in case they just say, oh, I don't feel like it anymore. Or maybe their assets run out. What if they don't have the money to pay for it? We don't know what the future holds. So for those reasons, you always want to protect yourself, no matter what.
I wanted to add on 2 points that I heard come up. One concerns unemployment. So I wanted to be clear that workers' compensation benefits deal with people who have some sort of impairment. And people who claim that they're unable to work because of an impairment get a certain type of benefit. However, if that same person files an unemployment claim, it is, I don't want to say implied, it's more than that. You are actually signing off that you're ready, willing, and able to work. So if you file for unemployment, it can have a detrimental effect on your workers' compensation claim. Just something to keep in mind. And then the other thing I wanted to touch upon is home injuries, and working from home. Again, it's interesting, the term course of employment and what that legal definition really means. I've seen claims where people were getting set up to work from home and they were lifting the printer that the employer had delivered to their home and somehow hurt their back. I've seen claims where police officers working from home in a completely administrative function, maybe they're doing payroll or something else administrative, and something happens to the neighbor across the street, fell in the snow. They run out the house to help the neighbor. Is that a compensable claim? I've seen them. So those 2 points I just wanted to touch upon and add a little bit.
Regarding unemployment, I agree. The benefits that you can receive, so we have medical benefits that you are entitled to receive usually, then there are what's called indemnity or money benefits. So temporary total disability is usually the most common one that people receive. It's when they're completely unable to work. You're entitled to 2/3 of your average pay. So your average weekly wage is normally determined based on how much money you earn. There's an algorithm or a time frame that's used, usually 14 weeks, which is a snapshot that they take it from, and you're entitled to 2/3 of your gross pay, which should net about the same amount that you would normally get in your pocket when you're having taxes and things taken out. Now, say for example, your doctor says you can't work, you're completely off, temporarily, totally disabled, you can't earn anything, can't work. And then 6 months go by and your employer releases you, and you say, well, I've heard before that if you got fired, you should file for unemployment. That's usually when you want to call your lawyer and you want to ask them, hey, do you think I can file for this benefit? Does that make sense? And normally I will say, well, let's think about the circumstances here. If your doctor says you can't work, and when you file for unemployment, you are certifying that you are able, willing, and able to work. Those things are in contradiction to one another. Willing and able to work and unable to work are opposite, right? You cannot be willing and able to work if you're totally disabled. So you have to think, do you need to file for those benefits? You're already receiving, usually, well, hopefully, you're receiving temporary total disability benefits. So you normally won't think to go and apply for unemployment. But say, for example, you're waiting on a hearing. I mean, I've seen this many a times where people are waiting for a hearing and then they get fired, but the doctor says they can't work and they want to file for unemployment. Now, I have seen instances where, you know, a commissioner will say, okay, well, it's partial payment, where they say instead of you getting temporary total complete disability, you get partial disability benefits as if you were partially able to work. That can happen. However, it really depends on what your doctor's saying. You can't say out of one side of your mouth that you can't work and then have benefits being supplied to you through unemployment. So that is a huge thing that you always want to look forward, you know, for seeing, and that's why you would want to have someone advise you of whether or not it makes sense for you to do, because circumstances in your life, unfortunately, sometimes can't wait for us to have a hearing. You know, I know we've had a backlog of thousands of cases at one point, especially since COVID, and that was down. But there are tens of thousands of cases of individuals, rather, who were injured. And all of those individuals have to be heard more or less in front of the commission. And so getting a hearing takes time. I've had hearings set for an injury that was just had, you know, it can be 3 to 4 months before you see a hearing. A lot of people don't have 3 or 4 months worth of savings to be able to maintain themselves while that happens. And so seeing something like unemployment can be an attractive thing, but even unemployment takes a while to get, depending upon the circumstances. So, you know, just talking to your attorney and seeing what you can do and how you can maintain this is again, just very, very important to decide.
We're running out of time a little bit. I'm going to pivot just a tiny bit. And Dr. Frazier, I'd like to know personally and professionally, How do you deal with things like social media or surveillance? How does that play a part in your authoring or drafting independent medical evaluations? Or even more so, what happens after you've drafted it and then you receive some information from a TikTok or Instagram or an investigator that was outside, the person's house? How do you deal with that?
Somebody's base jumping and they just had certain.
Mm.
My practice also does expert witnessing. And we will serve as an expert witness in the case. And usually that's when these things come across us.
And for the lay people out there, what does that mean? You expert, are you testifying? Are you
Yes.
documenting?
Yes, I am, when I do an evaluation on a patient and give them a rating, I am also stating that I'm willing to testify on behalf of the rating that I am giving. And sometimes that means testifying in court on behalf of the, patient or in behalf of my report. And so usually if I give an opinion that, that the patient can't work because of their injury, and then, there may be a social media posts where the patient was deadlifting 315 pounds or something like that. And then they may ask me then, well, how does that affect your opinion? And, there's always, factors involved in that. And that depends on, the patient's job, the injury in question. Just because you have a shoulder injury and that affects your ability to lift above your head does not mean that you can't hold a bar with your arms down low. Two different, mechanisms of action for the arm. But if the patient is telling me that they, have an injury and they can't lift anything above their head, and saying that in my clinic and showing me, responses in my clinic that say they can't lift above their head, and then they're on social media bench pressing something above their head, well, that will alter my opinion in that case. And so, yes, it has happened. And it's, it's something that comes up in that situation, but not usually during the course of treatment.
So the same question for you, Attorney Wells. How do you deal with the claimant that may have given you one sort of picture of the extent of their impairment, and somehow you get to a hearing, and somehow there's a post in social media or there's video from a surveillance investigator? What do you do to prevent it? And what do you do after it's already happened?
Okay. The Workers' Comp Commission, I like to describe it as the Wild West. You don't know what you're gonna get. Like anything can happen. So you try to prepare as best you can, but you can never sort of prepare yourself enough out of an individual who isn't quite being truthful with you. And so normally the best ways to sort of avoid certain things is, we as a part of our firm, we send out a social media documentation as part of our retainer. And we let people know, hey, whatever you post on social media,
They watch
make your accounts private. Turn them off, make them private, because I cannot express to you how many times I have seen insurance companies come and they have the TikTok accounts that are open and live, Instagram, Facebook, or whatever, of this individual who said that they can't even, carry back groceries, but they're, doing dance moves and whatever in, these videos. It doesn't get your credibility. So best thing to do off the back, as soon as you have these, just close, make them private, don't post everything. You don't have to narrate your life through your social media. Don't put everything out there.
please.
And you shouldn't do that anyway. You're as courteous as right? You shouldn't be doing that. So that's sort of a way to try to prevent it as much as possible, but sometimes you can't prevent it. And, I usually inform my clients, don't do anything that your doctor says you can't, right? because that is the biggest indicator. Like if your doctor says, don't lift more than 15 pounds, or you shouldn't be doing squats, or you shouldn't be doing X, Y, and Z. I had better not see a video surveillance footage of you doing that thing, right? Because you can always say, well, my doctor didn't say I couldn't do it. And well, who are we to say what you can and can't do if your doctor doesn't say, right? So if your doctor informs you, hey, you can do X, Y, and Z within your abilities, and you try to do that, going to the gym is not your enemy. If your doctor says you can go to the gym, right? If they say, listen, you need to be doing 15 minutes on the treadmill, I want you walking, I want you, I want you to try to, curl, 5 pounds, on each arm a day, so you don't lose your bone mass in your arms or whatever the case is. You want to just do what your doctor says. So I always say, hey, Maya, what do you think about such and such? Go talk to your doctor.
Mhm.
Ask your doctor. And what am I able to do? What am I capable of doing? What would you like to see me doing more of? That way, there's never a surprise when we see something later, right? If your doctor says, oh, in the documentation, limited mobility, they can't turn, left and right, or range of motion is X, Y, and Z. But then I see you playing tennis uninterrupted, which I've seen with people who just testified. I can't,
Not in court, not in cross-examination.
Certainly. They get very specific about their questions. They already know. So you just be honest. And that's another thing. I always advise people, no matter what, just be honest. Like whatever it is. Just tell the truth, answer the question that's being asked of you. Take your time. A lot of people get nervous, and it's not because they're hiding something. It's just because they don't like public speaking. They don't know how to phrase things the way that Dr. Frazier can, or Frazier can, or I know, right? That's just not their.
They're not Cardi B on the stand.
They gotta think about
Yeah, don't do this. Okay, you're sitting here, you're talking to me, and you're sitting, and you can see my body posture right here. And then I say, stand up for my exam, and you stand up. Okay, now bend forward. Can you bend forward for me?
Oh.
And I was like, okay, well, you were just sitting.
Yeah.
Your body was like this.
Yeah.
At 90 degrees. But when you stand up, you can't bend forward more than this. I'm bending, and you tell me I'm bending as far as I can.
Ah.
So that's just, you always want to try. You always want to tell the truth.
Mm.
You always want to, move appropriately, because I can't write in your chart that your flexion is 10 degrees. That is not compatible with doing anything in your life.
Walking,
So
yeah.
You will have
Yeah.
Inconsistencies are huge. Like, don't try to don't try to over exaggerate what you're experiencing.
Yeah.
If you are hurt, you're hurt. You don't need to exaggerate your injury. You just need to do the best you can. And doctors can tell, right? They can tell. Now, I might not know any different because I'm reading the report. I'm not there. But doctors know, like their assistants know. The IME doctors that are on the other side with the insurance companies, they're asking you to do one thing, but they're looking for something else, right? And that's how they can tell whether or not you're experiencing what you've experienced, like the objective signs of what your injuries are. The spasms, I'm on the fence about whether or not you can fake them. I don't think you can fake them, but some people say you can fake the spasm. I don't. Like those things should be things that you can't fake. They should be able to tell and say, okay, this is genuine. There are a lot of things that they can do to try to verify whether or not you are, your symptoms that you're expressing match what your injuries are, what you're experiencing. So just be honest, be truthful. Don't try to make anything more than what it is. Don't do anything your doctor says you can't. And you really shouldn't have any problem. Be honest. Be honest. That doesn't mean you have to tell everything in the world. You don't have to say everything, but you need to be honest. first.
In cases you say you settle, there's no, or is it more probable that you have a hearing, but maybe one side not happy and so you settle after the hearing? How does that work in your experience?
So I think that usually all good cases settle, right? And what do I mean by that? It's like things that are clear cut. You know, you have an injury, there's no question about how you had it. And it's severe, or maybe it's not, whatever the case is. Usually those cases generally resolve. We negotiate with the insurance company on your behalf to try to maximize your benefits as much as possible. You know, whether it's a knee injury and you had surgery, or knee injury and you couldn't have surgery because it was something that could not be repaired, or, you know, back injury that was inoperable sort of back injury. Anything is something that can usually be resolved. The more complicated cases, usually the ones that revolve around causal connection, whether or not, you know, you're experiencing what you're experiencing because of this injury that seem relatively minor, you know, to these insurance companies. Oh, you know, they're involved in a motor vehicle accident, and look at this property damage, it's a love tap, right? How is it now that they have all of these issues that they're experiencing? Those are almost invariably going to go to the commission. Almost anything that's low property damage, like with motor vehicle accidents, or the mechanism of injury doesn't necessarily match, you know, what you're experiencing, those will go to the commission. And even if they go to the commission, I can still settle it, right? Because then there's an appeal that can take place, which can either help maximize your ability to resolve a case, or maybe you could go to a jury who could hurt you. You never know. But normally cases can be resolved in many instances if you have injuries that are sensitive, or even usually.
It look like they about to wrap up.
I think we're all right. Questions that we can answer?
One person wants to speak to you after we're done. Did you have a question?
One question I asked was whether injuries need to be physical injuries. For example, a work demand that leads to falling asleep on the drawing board, or a heart attack.
Not all injuries have to be physical. You know, not all of them have to be physical. I think I mentioned again, there's a difference, like the psychological piece that involves where you can have, you know, internal issue that can happen. Really, just the more, I would say, the more it deviates from the standard, meaning standard is a physical injury, right? Non-standard would be something like what you're describing. The more often you're going to need a doctor to causally relate that to the injury or to your work condition, right? Whatever it is that deviates from that typical standard, you're going to need a doctor to support and say, you know, because X, Y, and Z happened, you know, due to this work-related issue, it's related to the work-related thing. So usually.
Thank you again, Dr. Frazier. Thank you, Attorney Wells. We're going to wrap up. Dr. Frazier actually had surgery in the morning. And but I think Attorney Wells might be willing to stay for a few moments and answer some questions. But thank you so much. I really appreciate your time very much. Thank you.
Thank you. Yes, definitely. Thank you, guys.
Yes.